Ladies, if you've noticed your back slowly hunching forward, if your reflection is starting to look more stooped, more slouched, please don't ignore it. This isn't just about posture. It could be a serious health warning. I'm Dr. Alex, and today I'm breaking down the 7 real reasons so many senior women walk bent over, and more importantly, what you can start doing right now to stop it before it gets worse. Watch all the way through, because reason number 7 is the one most women miss. And it's the one that can change everything. And hey, before we dive in, tap like, subscribe, and comment below. I'm standing tall, if you're ready to fight back against a stoop. 1. Weak core and abdominal muscles. Your internal support system is collapsing. Alright, let's start with the core, and I don't just mean six-pack abs. Your core is your body's natural corset, made up of deep muscles that wrap around your spine, pelvis, and abdomen. And these muscles are absolutely vital in keeping your torso upright. Here's the truth. Once your core goes, everything else starts compensating. Your shoulders hunch, your neck sticks out, your hips tilt forward. And before you know it, you're walking like you're carrying invisible groceries on your shoulders. Now, why does this happen more in senior women? As estrogen declines after menopause, muscle mass naturally drops, especially in the midsection. That's called sarcopenia. And it's more severe in women because of the hormonal shift. Many older women also reduce physical activity, meaning those deep stabilizing muscles aren't being challenged at all. So what's the result? Your spine starts relying on passive support, like ligaments and joints, rather than muscular control. That's when the body starts to collapse forward like a folding chair. It's not just a posture issue anymore. This becomes a spinal alignment crisis. And here's the kicker. You don't even feel this happening. It's silent, gradual, and deceiving. The fix? You don't need to become a Pilates instructor. Start small and smart. Seated pelvic tilts, even while watching TV. Standing marches with core activation. Wall planks, a gentler alternative to floor planks. Even just 5 minutes a day can begin to reawaken the core muscles that keep your back tall and your gait stable. Think of this as installing scaffolding around your spine. It's structural, and it's life-saving. 2. Osteoporosis, the silent shrinker that changes your shape. If you're over 60 and haven't had your bone density checked, this could be the most important thing you hear all year. Osteoporosis is called the silent disease for a reason. You don't feel it creeping in. There's no pain, no big warning sign. But one day, you notice you've gotten shorter, or there's a slight curve in your upper back that wasn't there before. What's happening? Your bones, especially the small vertebrae in your spine, are losing density, becoming more brittle and fragile. And when they weaken enough, they compress under the weight of your own body. This is called a vertebral compression fracture. And even though it might not cause excruciating pain, it bends your spine forward in an irreversible way. Now here's the hard truth. Up to 70% of spinal fractures in older women go undiagnosed. Most women just assume they're getting older or shrinking a little. But this shrinkage is not benign. It can permanently impact your posture, balance, and even lung function. Prevention is your superpower. Ask your doctor about a DEXA scan. It's a painless test that tells you your bone density score. If it's low, you can take steps right now to slow, stop, or even reverse bone loss. Start. Daily calcium and vitamin D supplements, as directed by your doctor. Weight-bearing exercises, walking, light weights, dancing, even gardening counts. Medications or therapies that rebuild bone if you're at high risk. Don't let your spine fold inward quietly. Bone loss can be fought, but only if you know it's happening. 3. Years of poor posture habits. Your body has learned the wrong shape. Let me be blunt. Posture is learned, and so is poor posture. The shape your body settles into didn't happen overnight. It's been years, even decades, of slouching over sinks, phones, laptops, steering wheels, and grocery carts. And now, your muscles have memorized it. This is called muscle memory, and unfortunately, your body doesn't know the difference between helpful and harmful habits. So when your shoulders round forward and your head pokes out like a turtle, your body says, "Ah yes, this is home now." But here's the problem. That position weakens your upper back, tightens your chest, and shifts your center of gravity forward. So you walk slightly hunched, slightly stiff, and eventually permanently stooped. How do you know if this is happening to you? Stand with your back flat against a wall. If your head doesn't touch the wall without effort, your shoulders feel tight, or your lower back flattens unnaturally, then your posture has likely shifted into a stoop pattern. Good news? It's fixable, but only if you start now. Try these posture resets daily. Wall angels. Slide your arms up and down the wall to open your chest. Shoulder blade pinches. Squeeze your upper back like you're holding a pencil between your shoulder blades. Neck retractions. Pull your head straight back to undo that turtle head. Think of it this way. You're retraining your body to remember what upright feels like. It takes weeks, but it works. 4. Spinal degeneration and disc issues. When the spine itself starts to fail. Now we're entering the structural territory. Degeneration of the spine itself. This is one of the most underdiscussed, yet common causes of that forward stoop in senior women. Over time, the discs between your vertebrae lose hydration. They flatten like worn-out cushions. This reduces the space between bones and causes everything to compress downward. If the degeneration is severe, it can lead to spinal stenosis, a narrowing of the spinal canal, or degenerative disc disease, both of which can result in chronic pain and stiffness. And here's what most people miss. This doesn't always hurt. In fact, many women don't feel any back pain, just a growing difficulty in standing tall. You might start using your hands to push off a chair or lean more heavily on counters. That's your spine saying, "I'm tired." Degenerative changes also lead to kyphosis, that upper back hunch, loss of natural spinal curves, a sensation of heaviness or imbalance when walking. To fight this, you need gentle, controlled spinal mobility movements. Nothing jerky, nothing high impact. Try cat-cow stretches on all fours or seated in a chair. Back extensions while lying flat or on a mat. Thoracic rotations, twisting gently from side to side. And remember, posture isn't just muscles, it's bones, discs, nerves, ligaments. The more mobility and support you provide the spine, the less it collapses under time. 5. Lack of glute activation. Yes, your butt is a posture muscle too. Ladies, we have to talk about your glutes. Yes, your butt muscles. See, most people think of the glutes as just appearance muscles, but in reality, they're foundational for posture, balance, and how upright you stand. And sadly, this is one area that often goes completely ignored, especially in senior women. As we age, we naturally spend more time sitting and less time using those muscles. Think about it. Sitting at the table, sitting in the car, sitting to read or watch TV. Over time, your glute muscles go to sleep, literally. This is called gluteal amnesia, or dead but syndrome. When the glutes stop firing properly, the pelvis tilts forward. This is known as an anterior pelvic tilt, and that drags your entire spine into a forward lean. The result? You're walking with your hips pushed back, your belly sticking out, and your shoulders compensating to stay balanced. It's the start of the old lady stoop, and it's totally avoidable. Waking those muscles up doesn't require a gym membership or heavy lifting. Try these. Glute bridges. Lying on your back, knees bent, lift your hips while squeezing your glutes tight at the top. Wall sits. Slide down into a seated position against a wall and hold for 20 to 30 seconds. Standing kickbacks. Hold onto a chair and slowly extend one leg behind you, squeezing the glute. Do these for just 10 minutes a day, and you'll be shocked how quickly your posture starts to shift. Because here's the truth, your butt isn't just there to sit on, it's there to support you. 6. Fear of falling, and the posture that fear creates. This one is deeper than muscle or bone. This one is about psychology. As a doctor, I've seen this so many times. A confident, active woman starts to feel unsure of her footing. Maybe she slipped once, maybe a friend fell and broke a hip, or maybe her balance just feels off. So what happens? She starts walking more cautiously, and that means more bent forward. Why? Because leaning forward lowers your center of gravity. Your body thinks it's protecting you. It's like crouching instinctively on a rocky trail. The eyes drop to the floor, the shoulders hunch, the knees stay slightly bent. Your posture becomes ruled by fear. The cruel irony is this: the more you stoop, the more likely you are to fall. Why? Because a forward-leaning posture actually shifts your balance outside your base of support. And if your vision is focused straight down, you lose your awareness of what's ahead, curbs, thresholds, or other hazards. So how do we reverse this fear-based posture? Step 1. Rebuild confidence in your balance. Heel to toe, walking along a hallway. Standing on one foot near a counter for support. Tai Chi or balance-focused movement routines. Step 2. Retrain your body to trust upright posture. Try walking with your eyes forward, not down. Even for 5 minutes a day. Use visual cues in your home, tape on the wall, or notes that say look up, shoulders back. Work with a physical therapist if you've already had a fall. They can help you regain control step by step. Remember, fear is understandable. But when fear shapes your posture, it begins to steal your freedom. And we're not going to let that happen. 7. Undiagnosed neurological conditions. When your posture is a symptom, not a choice. Let's talk about the most serious and overlooked cause of stooping. And I need you to pay close attention here. Sometimes, walking hunched over isn't caused by weak muscles or bad habits. Sometimes, it's your body sending a warning signal that something bigger is going on, something neurological. Here are a few conditions that can cause forward stooping. Parkinson's disease. One of the earliest signs is something called camptocarmia, where the upper spine leans forward involuntarily. The person can't stand straight even if they try. Spinal stenosis. When the spinal canal narrows and compresses nerves, it creates discomfort when standing tall. So people lean forward instinctively for relief. Cervical myelopathy. Pressure on the spinal cord in the neck can cause balance problems, clumsiness, and a forward lean as the body tries to stay stable. Peripheral neuropathy. Especially common in diabetics, this affects sensation in the feet, causing women to look down and lean forward to monitor their steps. The problem? Many women ignore these symptoms or assume it's just aging. They think, I'm slowing down, or it's just arthritis. But if you've noticed, trembling hands, difficulty initiating movement, a shuffling walk, loss of hand dexterity, numbness or tingling in your feet, then your posture might be a neurological red flag. If you're experiencing these, please don't wait. Speak to your GP and ask for a neurological evaluation. Early diagnosis in conditions like Parkinson's can completely change the outcome. Here's the bottom line. Not all stooping is caused by bad posture. Some of it is your body crying out for help. The sooner you listen, the better your chances of restoring not just your posture, but your entire quality of life.